Good afternoon, everyone, and good morning and good evening to those joining us from different time zones. The University of Global Health Equity warmly welcomes you to the launch of the Center for Transformative Learning Technologies. My name is Ornella Matsimbi. I'm a medical doctor, a lecturer, and the manager of the Simulation and Skills Center at UGHE. And it's a privilege for me to be the master of ceremony for today's event. Since the launch of the Simulation and Skills Center at UGHE 5 years ago, I've had the privilege of working with Dr. Peter Weinstock and Dr. Chris Callahan here in the room with me, and together with the support of the UGHE leadership and the simulation team in Butaro, we have built and grown the simulation program at UGHE to where it is now. And through this time, I have noticed through teaching with simulation how this can really impact the students and empower them and transform their educational learning process. But there is so much more things to be done within educational learning technology. So here I'm so excited and thrilled to be part of this next phase as we launch the Center for Transformative Learning Technology. And I hope you enjoy the agenda we have prepared for you today. So without further delay, I would like to officially welcome Professor Phil Cotton, the Vice Chancellor of the University of Global Health Equity, to deliver his opening remarks. You are welcome, Professor Phil.
Thank you very much, Ornella. And it's great to be with you, and it's great to see Peter and Chris on the screen in front of me. I want to make a connection, Ornella, with the clinical work that I used to do in the UK, where all of my work was done through an interpreter. And in the early days, I couldn't help but look at the interpreter, and the patient couldn't help look at the interpreter. Every time one of us spoke, we would reference back to the interpreter. And in time, as we built confidence with one another in a series of consultations, the interpreter just became part of the furniture, and the communication was between the patient and myself. And that took me back to learning communication skills and teaching communication skills, where you often had an observer in the classroom. As a student, I had an observer, and as an academic, I became the observer. And the critical point in the learning was when the student, the learner, connected with the patient, connected with the simulated patient, and forgot that the observer was in the room. And for me, that is really something of the power of simulation. So I've always been convinced about the power of simulation. Simulation causes us to attend. It causes us to learn how to be present. It causes us to learn how to connect. Connecting in your simulation center, Ornella, with peers, with the patient, and with the problem. And so to see the simulation center grow in the way that it has is just an immense privilege. What is key in the title of this new center? And other people may argue that transformative is key. I wouldn't ever argue with that. And technologies is key. But for me, what's key is learning, because learning precedes teaching and learning precedes assessment. I hope that this center begins to transform our worldview of assessment as much as it does our view of teaching, while always holding central to everything we do, learning. So I'm really grateful to be here. I'm really thankful that we have got to this point. Thanks so much to everybody who's made this happen. Special thanks to Abebe, and special thanks to Joe Rattigan, the chair of our board at the university. I'm accompanied today in my office with Dean Daniel, who heads up research in the university. And I know that he's very excited too about working with you in the center. But for the moment, I'll pass back to you, Ornella. Thank you.
Thank you so much, VC Phil, for your insight about simulation and officially opening the event. Now it's my great pleasure to welcome Dr. Joseph Rattigan, who is the chair of the board at the University of Global Health Equity. You are welcome, Dr. Joe Rattigan.
Thanks, Dr. Ornella. It's a real pleasure to be here. And congratulations to the team, Dr. Cotton, Professor Abebe, Dean Abebe, Bekele, Dr. Weinstock, Dr. Callahan, and yourself, Ornella. This is the culmination of many years of working together and a vision to really make UGHE one of the premier teaching institutions in Africa. I come to you today both as the chairman of the board, but also as a faculty member at Harvard Medical School who's worked with UGHE since it was first founded. And in that role, I just want to attest that the Simulation Center has been such a key part of the students' education at UGHE. It's intertwined into the earliest times that they join us, as well as throughout their medical education. And this was a vision that Paul really shared deeply. The idea that we as physicians don't just learn things through books and through lectures, that it's not that being a physician is not necessarily about knowing things, it's about being able to do things. And that's at the heart of simulation. And eventually the transformative learning technologies that the center is going to help develop and implement in the curriculum and in other medical schools. As chairman of the board, I'd like to say that the board is incredibly excited about the potential for the center. Again, the board sees UGHE as really an early leader in transformative technologies for education, be it the Simulation Center, which has already been incredibly successful and has really been the results of a long-time collaboration between Harvard Medical School, Boston Children's Hospital, and UGHE. And Peter and Ornella and Chris have led that over these many years. And we wouldn't be here today without that long history of collaboration. But the board also is hopeful that the center will take our efforts and our expertise in this area to a new level and really distinguish UGHE as one of the cutting edge teaching universities in health professional medical education. So thank you very much for inviting me today. I'm very excited to hear more about what the team has planned for the center, and congratulations.
Thank you for your words, Dr. Joe Rattigan. We have Professor Abebe Bekele, who is our Deputy Vice Chancellor for Academic Affairs and Research, and he's going to introduce about the CTLT. The floor is yours, Professor Abebe.
Thank you, Dr. Ornella. Good morning, good afternoon, colleagues. It's a real honor for me to welcome you to the launch of the Center for Transformative Learning Technologies here at the University of Global Health Equity. Today marks a significant milestone as we open doors to a center dedicated to pioneering academics, research, and innovations that will shape the future of equitable healthcare. At UGHE, we are committed to advancing equity in health, and this center embodies that mission by harnessing the power of technology to address some of the most pressing health challenges of our time. From digital health to artificial intelligence, from simulation-based education to innovative e-learning, data-driven solutions to advanced education in technology, and teaching and learning, our aim is to leverage transformative technologies to enhance healthcare access, quality, and efficiency across Africa and beyond. This center will be the hub for collaboration, bringing together experts, students, and partners who share our vision of equitable and accessible healthcare for all. I'm sure we'll embrace this journey with purpose, innovation, and an unwavering commitment to health equity. Please allow me to extend my special thank you to Dr. Peter Weinstock and his team, Drs. Chris, Ornella, and the SIM Lab team, who are leading this effort, led by the chair, Dr. Peter, and the entire UGHE community, who are committed to make the initiative successful. Our partnership with Harvard Medical School through the Paul Farmer Collaborative, supported by the Cummings Foundation, also deserves special recognition. This initiative would not have been possible without the strategic leadership provided by the board chair, Dr. Rattigan, and the Vice Chancellor, Phil Cotton. Thank you for joining us in this remarkable endeavor, and welcome to the Center for Transformative Learning Technologies. Thank you very much. Back to you, Ornella.
Thank you very much for your words, Professor Bebe. Now we are entering the core part of this event. It's with a great pleasure that I would like to officially introduce to you the chair for the Center for Transformative Learning Technologies, Dr. Peter Weinstock, who is a professor at Harvard Medical School, and he's the founder of the Immersive Design System, as well as a senior associate of critical care medicine. And Dr. Peter Weinstock will be with our colleague, Dr. Chris Callahan, who is an adjunct assistant professor at UGHE, and also a faculty investigator at Brigham and Women's Division for Global Health Equity. You are very welcome today, Chris and Peter.
Thank you, Ornella. And I just want to begin first by saying I'm just absolutely thrilled to be here today. I think we've all been so excited seeing this day approaching, and I can't believe it's here. So we're just thrilled to be here and to have all of you here joining us. I want to start, as I will finish, with thank yous. It's amazing already how many people have been involved in this journey. Again, I want to just highlight Dr. Masimbi Ornella, my dear friend, colleague, and partner, Chris Callahan, and the simulation team, and a very special thanks to our Vice Chancellor Cotton. He's been amazing, and it's been wonderful to get to know Dr. Cotton. Dr. Bekele is really a big part of why I got involved with UGHE back in 2019. Just a remarkable individual and inspiring to me. And so it's a privilege to continue this journey together. Jim Kim, and of course, Dr. Rattigan, Joe Rattigan, my friend and colleague from Harvard. It's wonderful to see you here. And thank you for the welcoming remarks to all of you. And then everyone else listed on this slide has been deeply involved in this journey already. And I look forward to lots more partnership moving forward. A special thanks also to my team back at Boston Children's Hospital, Dr. Joe Crivero, who's my department chair, Nilesh Mehta, my division chief, Peter Lawson, EVP of Health Affairs, Tracy Walbrink, my dear colleague in the Division of Critical Care, who's going to be joining up and helping us in the e-learning pathway, Liana Kappas and Stacy Conrad. So thank you, and let's get started. Also, big thanks to the institutions and the foundations that have made this possible, and you've already heard mention of that. University, of course, of Global Health Equity, the home of this new center, and my new home. Harvard Medical School, Boston Children's Hospital, and Partners in Health, and of course the Cummings Foundation and the Paul Farmer Collaborative that have made this day possible and the center possible, and the support of my home foundation at Boston Children's. So why are we doing this? It's just becoming clear that education is forever changing by new human-centered technologies. There is a wave of these that we're seeing continuously presenting itself on the world stage, and we need to respond, and we need to leverage this ever-changing field. And the future is now. We know that things like, for example, anatomic 3D printing is starting to become more and more prevalent in various areas of healthcare. And it's just an example of this sort of tweaking of simulation from the ways we used to think about it to this new frontier. XR and extended reality, and augmented reality and virtual reality are here. And we are now able to, for example, as you're seeing here, bring digital content into our worlds and be able to use that as incredibly effective teaching tools. And you're seeing here, for example, describing the heart and bringing it into the room with students. Here's a stenting of a coronary artery, and not talking about it or bringing us to a textbook, but actually bringing it into the space. And these capabilities are now available, and the question really is how to leverage them most effectively for our students and trainees. AI has clearly arrived. And broadly, we think about AI in sort of two domains, and lots more to come on this through the center in terms of AI education and methodologies. But suffice to say that there's really sort of a predictive component to AI to affect and hopefully enhance our care delivery. And there's a generative, a large language model, machine learning version of AI, and that's really the sweet spot for training. And it's really the center's intention to really leverage both of these very heavily. AI is showing more and more traction in education. We're seeing it in intelligent tutoring systems, grading and assessment, as Vice Chancellor Cotton alluded to, chatbots, curriculum planning, learning analytics, and so on. And so it's very exciting. There's this wave of opportunity to leverage AI effectively, but with caution. And so equally, a focus of the center is going to be on responsible use of artificial intelligence moving forward, acknowledging and really risk mitigating the challenges, including things like data privacy, bias, which we know is inherent within the current learning systems, and of course, taking safeguards against plagiarism and so on. So it really behooves us to think about artificial intelligence holistically, and not just as a silver bullet, but really as a tool to be used responsibly. But here's the exciting part of artificial intelligence. It is going to accelerate the learning curve. This is the RHYME framework of Pingaro, Louis Pingaro, just as an example of a kind of way to think about education where students begin as reporters traditionally. They're mining data, they're looking for content and accumulating content. And as they move through their years, they become interpreters of that content, they take ownership of it and start explaining it to others. They then become managers of that content. They use it to apply therapeutics, for example, using that knowledge. And then ultimately, they become the educators, both of our patients and families, but also of the next generation of learners. And what's clearly happened with artificial intelligence and what we're likely to see moving forward is that the reporter aspect, the ability or the need to, for example, memorize lots of data is going to vanish. It's going to be unnecessary because large language models and generative AI is going to present that data to our learners and to our students on demand. And so what that entails is that then we need to then prepare them for the next stages in the early days, meaning the interpreter and manager stages are going to come sooner. And so we really have to think about how to adjust our frameworks of education that will then fit and accommodate artificial intelligence and allow us to leverage it most effectively and let the students get the most maximum benefit out of it. But I also found this really interesting. This is Bernie Chang out of Harvard Medical School, the dean at Harvard Medical School, who said this, and it really, really meant a lot to me. And that is this reinforcement that AI, I think, is going to do about the human touch. Because as he says here, it's important to remember that one of the most technologically irreplaceable elements of the curricula is the guided development of skillful interpersonal communication and the physical exam. And so as AI starts to provide all of this data to us on demand, what it will leave us with is the importance of human connection, of relationships, of patient advocacy, and the ability to take a very focused and effective physical exam. And he says at the end, the laying on of hands is unlikely to be supplanted, at least in the near term, by any AI-enabled chatbot. So I think what AI will do as it advances us in innovation is bring us back to our humanity, and I'm excited for the center to stand for that and to help students focus on what's important. I want to just say one other thing. We've talked about AI now a bit, and we've talked about virtual reality, but there are large opportunities in the amazing simulation center at UGHE to continue to build on its heritage. And I want to just focus on just a couple of elements that we're intending to explore. One is that simulation itself is sort of not just a teaching opportunity, but a convening opportunity. It's an opportunity for relationship building. It's an opportunity for connection and mental model sharing around a clinical entity or a situational entity. And so at the same time that learning is happening, relationships are forming. And how do we use that even more effectively to create strong healthcare teams? Because in the end, what immersive technologies really does, particularly in the debriefings, is that it creates the opportunities and allows for the practice of human-human interactions and human-human connections. And for the last 5 years with Dr. Masimbi and Dr. Callahan and the entire simulation team, we've been training faculty throughout the UGHE system, throughout areas, a good portion of Rwanda, and now into East Africa. We just came back from a trip to Tanzania to Zanzibar. And we're training and teaching and spreading this knowledge about how you form these therapeutic conversations, which is really what is at the core of debriefing, such that you can enhance human-human interactions and strengthen teams. So let's dive into the Center for Transformative Learning Technologies. The mission is to be a highly collaborative resource to explore and transform the future of medical education and training for trainees, for professionals, all through cutting-edge, immersive, and AI-enhanced technologies. And we could not be more excited about getting started on this mission. But inherent in this is partnership. We really see the Center for Transformative Learning Technologies as a sandbox, as a place for people to come together, to create unexpected collaborations and partnerships, and to create great curricula, great educational tools, and great products. And key partners from the get-go, already heavily involved in our development, is the Innovation Center with Dr. Rex Wong, who's been extraordinary in this process already and a real partner. The Center for Equity in Global Surgery with Barnabas, Dr. Barnabas and his work have been essential and central to what we've done to date. We're excited about strengthening partnerships and exploring new ideas with the Education Development and Quality Center, the Institute for Global Health Equity Research, and the UGHE Partnership and Development Office, and so on. So really, it's bringing together these programs that really forms the core and the heart of the CTLT. The pillars and the organization of the center is as such. It's CTLT Sim, it's XR and VR and extended reality, it's artificial intelligence, and it's e-learning. These are the 4 pillars that you'll hear about throughout this presentation. So before we get to the specific launch projects, and Dr. Callahan's going to do that along with me, I really want to talk about how we're going to get there. And I just love this picture because it shows you this vantage point and this view. And we will get there because we have a strong strategy. And the approach is going to be in 3 steps: adaptation of this new idea, adoption of the idea, and advancement of the idea of the center. I happen to be a fanatic about design, industrial design, center design, programmatic design, and I look back to designers to think about how do you build these successfully? Why reinvent the wheel? Use frameworks and concepts that have been used successfully out in other industries. And this is a sort of an idol of mine. This is Raymond Loewy. Raymond Loewy was one of the most famous industrial designers of his time, and he designed unknown products like this one. So he designed the Coke bottle, as well as many other logos that you have seen and are very, very familiar with. And Raymond Loewy has had several sort of frameworks and approaches and methods that he stayed true to that has now been adopted by many in the design industry to this day. And one of them is this that really has always resonated with me as I've built centers throughout my career. And that is, he said, to sell something familiar, you need to make it feel surprising. But it's this other piece. To sell something surprising, like an innovation center, you have to make it feel familiar. It's just human nature in order to get adoption and successful integration. And actually, many companies have used this philosophy. Apple, actually, when they released the iPod, it's now known that the iPod was a training device and a familiarity device for what they already had in the pipeline, which is the iPhone. And so iteratively, rather than just launch the iPhone right away, iteratively, they sort of got us familiar with these concepts of a finger touch and a no button interface and so on, and then successfully launched the iPhone as predicted. And so this gradual iterative approach is very successful in going from familiar to new. So these are the design strategies. The idea is to advance the design gradually over time, use familiar patterns and create language and standard names around the center, draw on the current user and system skills and mindset, make it feel natural, enable users to use it immediately, and you'll hear about launch projects that are already being explored that will have immediate value to the university, and enable users to use it in their real world. And we've got a jump start on this. We already have an immersive technology language, the SIM zones architecture, and we'll be leveraging this even further in the new technology pillars. And we already have an international connection network that is forming, and we're super excited about. We have a consortium currently of centers throughout Rwanda, some of the key partnerships with academic institutions throughout the country that are forming, and connections are being made around simulation and immersive technologies, with the hope that eventually this will become the first Rwandan network for simulation, and UGHE will be key to forming that. As I mentioned, we're also doing some international work, trying to spread and create capacity around immersive technology capabilities in other countries, and that's enormously meaningful to the team and to the university. So that's a little bit about adaption and how we utilize design thinking and design strategies in order to do this successfully. So more to come on that. I want to talk a little bit about adoption now. And really core to this is what we call our CTLT cores, our guiding principles, what we stand on in terms of how we move forward, our north. The CTLT core number one is that we will never get fixated on shiny objects. This isn't about fancy technology. It's not about bells and whistles. It's about, as Vice Chancellor Cotton said, it's about learning. It's about improving the lives of our trainees, improving their experience, so that they can then take the best care possible of our patients, our families, our communities, and so on. So it's not about the technology. That will change over time. We want to become somewhat agnostic to that and go to our core, which is really our methodologies and our infrastructure. So lots of talk about mannequins and virtual reality and even 3D printing. But again, our focus is really going to be on the why of the CTLT, which is really about building a technology center that builds connections, as we've talked about, that will benefit ultimately our patients, our families, and our communities. Core 2 is to celebrate failure. You cannot be a center of technological advancement if you're not willing to fail, if you're not willing to take chances, if you're not willing to be somewhat courageous and enjoy in that courageous moment and do it as a team. And this has been always meaningful to me. This is St. Augustine. I was a philosopher before I was a physician, and he was one of my favorites. And he said famously, "I may be mistaken, therefore I am." And this is in direct contrast to Descartes, who said, "I think, therefore I am." I like St. Augustine's idea better. You fail, and through failure is the entryway to development and growth. And so we are building the center as a center to come, to try things, to fail, and know it's safe to do that, and know that that is the iterative step to success. And fundamentally, it's really about reframing from threat to opportunity. And we already do this in the Sim Center, where we bring students in and we help them reframe that when they make a mistake or they make a decision that could be improved, this isn't a threatening moment. This is a tremendous opportunity to grow and advance, so that feeling of failure being something to celebrate is going to be inherent in what we do. The third is related to this, and this is an air traffic controller. And simulation actually started in the late 1970s because of a crash in the Florida Everglades of a plane. And the plane was being flown by senior pilots and crews, and actually the air traffic controller was a senior air traffic controller. But despite the fact that this plane was heading into the ground, the air traffic controller only asked, "How's it going up there?" Never actually said, "Pull back and bring the plane back up, you're crashing." And the reason why the air traffic controller didn't say that is because there was a lack of what is now known as psychological safety. And psychological safety is the CTLT core number 3. It's fundamentally the ability for someone to feel comfortable and risk-free to speak up and to share their ideas, to be part of a learning community, and to even disagree and feel safe in doing so because they're adding into the team and adding into the thought process. And so a foundation of psychological safety has always been important to the Sim Center, and it will now be extended into the entire CTLT as fundamental to our growth and development. The CTLT Core 4 is really essential, and that is to understand and capture all learning types within what we deliver. So as we start to build these new technologies and we start applying them across the education landscape, we're going to be building them intentionally in order to apply and appeal to what we now know is that in any audience, there are 4 types of learners, and this is the work of David Kolb. And it's important and behooves us to create educational curricula that captures all types of learners within single settings. And simulation is just such a wonderful application of that, because as you walk through that process, from a simulation to a debriefing, to a conceptualization of new ideas and solutions, and then bringing them back into the simulator and experimenting with them, whether you're in a traditional simulator or in goggled virtual reality, having those curricula be intentionally designed to capture all the learners at different times in the curricula is really effective and efficient and enjoyable learning, and that will be a focus of what we do. So related to this is probably the most important thing I'll share with you, in that the true transformative innovation that we will be leveraging already exists within the Simulator Center at the University for Global Health Equity. And that is that we reinforce and teach people about being transparent, empathetic, vulnerable, open, honest, compassionate, and fundamentally curious and not certain. It's what we train debriefers to do and facilitators to do. It's what we try to model for our students. And when you think about these qualities, these characteristics of a person, probably you're not far away from someone who you fundamentally feel loves you and that you love in return. You think about the teachers that you've had throughout your life and the mentors that you've had throughout your life that have shared or demonstrated these qualities. They likely made you feel loved. And so we say our motto is love the learner. Whether that's a student, a trainee, whether that's a colleague that you're working with, or whether that's you. It's important to feel that and to demonstrate it and to transmit it. And that fundamentally, that's the disruptive innovation in healthcare, is bringing people together and making people feel loved. I want to turn this over now. I want to talk about how we're moving forward. And I just want to say something about Dr. Chris Callahan. I have mentored many people in my career, and it is the rare mentee where you learn more as a mentor than you give. And Chris Callahan is that person. I've known Chris now for 5 years or longer. I don't know whether he's a friend or a son to me or what, but I know he's enormously meaningful and incredibly talented and extraordinarily committed to the university. And I'm inspired by that. And I feel like very fortunate to have him a partner in this journey. So I thank Chris for that. I'm going to hand this over to Chris. He's going to talk a little bit about where we're going and how we're getting started, and in particular, talk about the launch of some of our projects that are in development. Chris, over to you.
Great. Thank you, Peter. And thank you for your unnecessarily kind words. Thank you everyone for letting me join today. And I have the privilege now of sort of walking you through a few ideas that we have for how we're gonna really get this center off on the right foot. And so as Peter sort of set the groundwork for the mission and the values of the center and some of our core beliefs, I'm gonna just walk through each of the pillars that Peter mentioned between simulation, XR, VR, AI, and e-learning, and just give you a little bit of a taste as to what kind of projects we're thinking about doing as we look towards the next 12 months and beyond. I think the only other thing to mention on that is that, you know, one of the core tenets of the projects that we're going to talk about are really fundamentally trying to align with partners, both in academic spaces and industries, to really bring this technology to life, you know, and really accessible to as many people as possible. So without further ado, for our first pillar, we're going to talk about SIM. So simulation to date at UGHE has really been focused mostly on a Butaro campus, and I'm incredibly proud of Ornella and the team in Butaro that have built an absolutely amazing center there and a program that's integrated longitudinally across the MBBS program. But we've realized after doing a little bit of introspective review that our students are starting to rotate all over the country, and in conversations with folks around sort of trying to build a Rwanda simulation network, there's really a desire to decentralize the simulation that we're offering. And so, under the simulation pillar, one hope that we have and one project that we're hoping to launch over the next year is a in situ mobile CART network. And the way that this would work is to roll out a cart, something like this, that's technology enabled with most of the technology that you would see in a fixed simulation center. But it would really be able to enable targeted team interventions, targeted clinical interventions at high need hospitals, and in a very flexible modular way to really enhance feedback mechanisms and workforce strengthening. So that's the first project that we're very excited about, and sort of the launch project for our simulation pillar. Moving on to XR VR. So this is a technology that is new to a lot of us, and I think we are very excited to get our MBBS students into the extended virtual reality space. So I think our first hope with this pillar is to do a pilot in the MBBS program in collaboration with the basic medical sciences faculty and the clinical sciences faculty to identify certain courses that would be best fits for XR and VR. And what we have here is a picture or a couple pictures of Dr. Masimbi just right here in our Kigali Heights classroom last night. This VR headset that she's wearing connects to the Wi-Fi here and fits in my backpack. And you can see some screenshots of what she's seen on the right-hand side here. She was immersed in a 360-degree emergency room scenario, taking care of a patient with heart failure, and going through all the steps of history and physical exam, obtaining vital signs, getting an EKG, chest X-ray. So our hope for this is that it really offers students additional opportunities to practice with simulation off hours, either by themselves, in teams. It also sort of expands the clinical scenarios toolkit that we could offer, beyond what simulators we have in the simulation center. And it really adds to the previous hope of the last pillar to decentralize. These can be used anywhere throughout the country. You can travel with them. So it really gives us a lot more flexibility in the space of simulation. And we're excited about that. So for our third pillar, which is AI, this is an example of a AI-enabled analytic and feedback mechanism, that can be used in an operating room to provide real-time optimization of trainee or surgical performance. And so what you see here on the right is, you can install these systems in either a live operating room or in a simulated operating room and get real-time, AI analytics based on how the surgeons are doing with their skills, full view of the room to make sure that nobody's, breaking the scrub barrier. It can pick up audio to see how people are communicating during the case. And so there's a lot of potential here to offer significantly increased performance feedback to both trainees and working professionals in this space. And lastly, I think UGHE is very excited to soon be launching its Master's in Health Professions Education, and the Center for Transformative Learning Technologies is really excited to be partnering with the rest of the university to develop a simulation and immersive technologies track within that master's program. And so we think that, we do some pretty cool stuff at UGHE, and we really want to be able to sort of capture that and put it in online and hybrid format to sort of expand the best reach that we can for some of these educational best practices. So those are some ideas for each of the pillars that we have. Sort of just the beginning. We're doing a lot of exploration as we speak, but I'm going to turn it back over to Dr. Weinstock to close this out.
Thank you, Chris. I want to close this first section with a thought again from Raymond Loewy. One of the things he was able to identify is the importance of when you build out innovations or you build out new ideas and start to introduce them. The question is, how do you make them lasting? How do you make them not just to be adopted, but actually held, integrated, and continued into the future by those who welcome the new innovation? So how do you make it lasting? And the story is about the space shuttle. Raymond Loewy actually designed the space shuttle. And as many of you recognize, that famous porthole in the space shuttle. And for years, people tried to figure out why he put this in here. It was circulating, these shuttles were circulating way, way above the Earth. But he did this for a very intentional reason. He realized and became one of his methods that it was really critical that when you build something new, you have to allow it to serve in two ways. One is that the individual can look forward into this new idea, but it's critically important that that individual be able to also have a sense of the past. And he famously said that a window into a new world, these astronauts that were surrounded by technology, they still had the ability to look out this porthole and to see Earth, and it allowed them to still see home. And we very much think that way as we build out the CTLT. We want it to feel like home and for it to be a tremendously effective and enjoyable resource to the university. And we're excited to build it. Finally, I just want to close by saying thank you once again to the university, to all of my colleagues there, the UGHE family. It's been an amazing journey for the last 5 years, and I just can't wait to see what's coming. And I just want to also say that it's become a bit of a family affair. In the top right corner is my wife, Lisa, who's been to the UGHE campus in Butaro several times now, starting to gain friendships there and really feels enormously connected. And in the lower right is my daughter, Hannah, who also has been to the university and feels deeply for it. The one left is my son, Noah, who will be getting there hopefully very soon. So a deep, deep thanks and personal thanks from me and from my family for the opportunity to come even closer to all of you and to work so closely together. That concludes the presentation part of this. We have about 10 minutes or so, or just a little less than that, but maybe about 5 minutes. If there's questions, I think Dr. Masimbi is going to just kind of host the chat. If there's questions, we'd love to, or comments, please feel free. Of course, any of the panel speakers are welcome to add some comments as well. So we'll just open it to the floor for about 5 minutes. If people have anything they want to add, we'd love to hear from you.
So I'm here with Dr. Masimbi, and we're just going to read one of the questions from the chat that
Right.
maybe we can that put to you, Peter. But so we have Arlene Nishimwe, who is one of our junior faculty here at UGHE and who you know well from hosting in Boston many years ago. She said, so excited about the CTLT. Quick question, how will the CTLT leverage, use, or integrate the softwares and instructional design technologies that we already use and are familiar to students at UGHE, such as Canvas, Complete Anatomy Software, Osmosis, etc.?
It's a great question, and greetings, Arlene. It's wonderful to hear your voice digitally. Yeah, I mean, it's a great point, and it's something we're very focused on. It's a little of the porthole of Raymond Loewy. It's the ability to move forward, but to be able to still look back and make use and leverage what the good work that has been done to date. And we very much will be taking that philosophy. So we won't be reinventing any wheels. We'll be taking what is there, leveraging what has been done successfully, and then moving forward and improving where we can and innovating where we can. But no major changes in the early days. And in fact, much of what already is in place works well, and we will continue to utilize those resources. Again, we really want this to be, so to speak, an ergonomic experience. So we don't want this to feel cumbersome as these projects unfold. They should feel natural, and the sort of interface of them should feel somewhat seamless. And so we will very much build it with that in mind. And that feedback is going to be important to us, feedback in general, to hear how things are going as projects launch and as new innovations are introduced. Thank you for the question. It's phenomenally relevant.
Thank you, Dr. Weinstock. I'm also seeing a few comments in the chat, just thanking you and the team for this presentation. You know, we have a few more minutes. If anyone else has any questions, either from the audience or here in the Kigali classroom, please feel free to speak up, and I can make sure that the question gets transmitted to the panel.
Hi, everyone. This is Rex from the Innovation Center from UGHE. I'm just excited to see the launch of this center. And I think the vision and mission of the two centers, they align really well together. And together we can actually create exciting opportunities to make real changes, not only in the field of education, but also in solving problems, complex problems in healthcare and global health. So I see there many opportunities for the two centers to collaborate and bring new ideas together, supporting the new generation of learners to problem solve and become entrepreneurs in the future. And whoever is interested in this particular area, that will be able to create a platform for them to make some real changes and creating some important impacts. So I'm just happy to be part of this journey, and I just want to say congratulations.
Thank you so much, Rex. Thank you. From the very beginning, when we started to talk about this back in Butaro just this past year, Rex and I sat in the cafeteria, and Rex said to me, "How can I help? How can we make this successful?" And he's just been an amazing partner from the very beginning. So Rex, I look forward to lots of fun projects together and working closely together. And I so appreciate your partnership. Thank you.
All right. So Lillian Owase said, "Thank you very much for the excellent presentation. I found it insightful, especially regarding the integration of technology into students' learning processes. I'm curious, are there any plans to go beyond this and engage students in actively creating or innovating technology? Specifically, will there be opportunities for students to learn how to develop new technologies, especially those that could contribute to advancements in medical technology in the future?"
Thank you you saw me smile when I heard that question. Thank you so much for asking it. The answer is a resounding yes. So we really are excited about this center also being an education center about transformative learning technologies. And we're delighted that in the first year, for example, there'll be a new course about transformative learning technologies for students from the very beginning to start to get exposure, not just to the technology, but to the methodologies and to the utilization, so that they become the ideators and innovators of the future. So we are thrilled about that aspect of the center and hope to have that launched pretty soon.
Thank you, Peter. We have a couple more questions actually coming through here. So one of them is from Samuel. He asked, "How do you plan to collaborate with different divisions/departments to bring new or efficiently utilize the current technology systems at the university?"
Great question. You know, as we build out the sort of infrastructure and governance of the center itself, key to that is going to be advisory groups, and we're going to start building those. And so it's not going to be just a random or happenstance about input. We're going to very much formally put that into our infrastructure so that we're continuously having those conversations about what's happening and how to utilize the center most effectively. So stay tuned. This team is going to expand and broaden so there's good representation throughout the university to make the center as effective as possible. So great question. More to come.
Great. And I'm just going to close. There's Eric had two questions here. The first one also thanked you and your team for excellent job. Asked about any insights into the cost effectiveness of these technologies. And then the second question, will the center offer training of trainers? And I think we'll wrap up after that.
Yeah, so I'll answer the second question first. Yes, that's very much the ethos of the center in the simulation program since its origins, is to train trainers and expand the capabilities. The first part of your question is also near and dear to our hearts and really reflects the idea of the return on investment and the cost benefit analysis of these technologies to make sure that if we're delivering them, we're doing them equitably, effectively, and economically, so that the return is greater than what we put in. So that's going to be very part and parcel of how we build projects, is to think proactively about the return on investment, locally, nationally, and internationally. Great, I'm getting a thumbs up. So I'm going to close very briefly just to say thank you. We're thrilled about what's coming. Again, deep thanks to Dean Bekele, Vice Chancellor Cotton, Joe Radican. Thank you for being here. Dr. Masimbi, thank you for hosting the day, and Dr. Callahan for your partnership. Excited for what's ahead, and stay tuned. So thank you again, and thanks for joining today. Have a wonderful afternoon.
Congratulations, everyone.
Thanks, Joe.